So welcome everyone to the 2023 Virtual Compassion in Action Healthcare Conference. I'm Julie Collier, Senior Director of Programs at the Schwartz Center. Thank you for joining us for this panel discussion, A Wellbeing Revolution, an Interdisciplinary Framework as a Foundation for the Future. Please join me in welcoming our presenters. Saber Boyd is the Senior Director of the Center for Wellbeing at Children's Mercy, Kansas City. Dr. Stephanie Burns is Chief Wellbeing Officer at Children's Mercy, Kansas City, and an Associate Professor of Pediatrics at the University of Missouri. Amy Hoflander is the staff educator in the Center for Wellbeing at Children's Mercy. And last but not least, we have Kristen Ray, who is a nursing director in the Center for Wellbeing at Children's Mercy. Welcome all. We're so happy to have you here with us today, and we're looking forward to hearing about your work. I'll pass it off to you.
Thank you so much, Julie. We are really excited to be here. I'm going to share my screen, which I hope I can do flawlessly because I have practiced at least once. So hopefully you all can see that. So again, thank you. We really are so incredibly grateful for this opportunity to be a part of this amazing conference. And so grateful to the Schwartz Center for their incredible work and how you support the mission of compassion in healthcare for so many of us. We are newer Schwartz Center members. We've been members since 2020. And even though our tenure with the organization has been not been as long as I have seen many of you talk about in the conference already, the support and the guidance have been wonderful. We've learned so much from the Schwartz Center, and they continue to be an integral part of what we are doing here in our work around well-being at Children's Mercy in Kansas City. So we're grateful for the opportunity to share about our journey that we have been on and our experiences in building a well-being framework in our organization. So just to level set a little bit, just want to tell you a little bit about who we are. We are an independent children's hospital. I think there are around 30 independent children's hospitals in the United States. We are one of those. We are a tertiary care center serving the Midwest region of the United States with both local and satellite locations. And we have a healthcare workforce of over 8,400 individuals. In addition to that, this is a picture of our campus. One of the buildings that you see, the really shiny one there, is our new Children's Mercy Research Institute, which was completed in the last couple of years, a wonderful addition to our organization. We are a level 1 trauma center and also have one of the busiest transport programs in the country. So just to share a little bit about us. And we have a really, what I think is a unique and interesting history to our organization. I wanted to just share a little bit about that. Children's Mercy was founded by 2 women. We fondly refer to these 2 women as the Berry sisters. One was a dentist and one was a physician, Dr. Alice Berry Graham and Dr. Catherine Berry Richardson. Now, these ladies were decades ahead of their time. They were incredible pioneers when it came not only to providing healthcare, but also collaborating with their community and also forging ahead and promoting diversity, equity, inclusion in education of healthcare professions. So I know this photo is a little fuzzy, but it's one of my favorites about our history of our organization because really, our hospital was built on the foundation of compassion. And this particular photo is of 4 patients, and they're standing next to a chalkboard. And that chalkboard was located out in front of the hospital of what was then called the Hospital of the Little People. And when there were needs in the hospital, Dr. Richardson would put what those needs were, and she would write them on that chalkboard out in the front yard. And the public would see those needs as they rode the streetcar, yes, the streetcar, back and forth to work. And that action that she did created awareness and the community responded to that. We know that compassion and well-being are inextricably connected, and we are dedicated to continuing actions in our organization to radically impact the well-being of our healthcare workforce. I know that it's very likely that most of you who are attending today are familiar with why well-being is so important, but just wanted to do a quick review of the trajectory of the work of well-being. This probably, like I said, looks familiar, but we're talking about action. After all, this is the Compassion in Action Conference. And when we think about action or the lack of action, it's really central to the advancement of the work of well-being in healthcare. So going back to the era of distress, that sounds so ominous to me, but I understand why they labeled it in that way, because there was really a lack of action when it came to well-being. It was more of a mentality that those of us who were going into healthcare, we knew what we were getting ourselves into. This is what we signed up for, knew it was going to be challenging. And our organizations had the same mentality. And so there wasn't a framework or really a structure or frankly, even an acknowledgement of the difficulty of working in healthcare. In 2007, the Institute for Healthcare Improvement came out with the triple aim, which many of you are familiar with, lowering our cost, population health, and also increasing the individual patient experience and making it better. A fourth aim was actually added in 2014, because that's where we really started to understand and recognize burnout as being a significant major issue in medicine. A lot of people that we have talked to really attribute the current spotlight around well-being as a response to COVID. But as most of you know, this work began long before the pandemic occurred. In the last couple of years, in addition, the triple aim became the quadruple aim as we identify the integral role of equity in healthcare. And so with the addition of that, many institutions moved into this middle section of Wellbeing 2.1. They created well-being committees, they instituted other programs, and most of those focused on personalized resilience, which is a great thing. We want and need those in our organizations. And this is where a lot of our organizations are sitting today. There are some organizations who have started to move into the Wellbeing 2.0, which is really about broadening that focus to include the culture of our organizations and also workplace improvement. And we're going to talk a little bit more about that with my colleagues. This work, this moving into the Wellbeing 2.0 space has really been a catalyst for us at Children's Mercy to conceptualize and modify a model for well-being. And looking at expanding the work just beyond the well-being of physicians and really focusing on our entire healthcare workforce. This work absolutely has to be done in partnership with a lot of people. It's about partnering with other groups like our Office of Equity and Diversity, our Office of Quality and Safety, patient and family engagement, senior leaders, executive leaders, all across our organization. If we were to break down where our current healthcare organizations sit in these three different sections, about 20 to 25% are still in that era of distress. And then we have about 75% who are moved on to that middle section of Wellbeing 2.0. And then there are about 1 to 5% that are in what we call the Wellbeing 2.0. So we've shared a little bit about the why. Why is this important? So now we want to share a little bit about the what. So what does Wellbeing 2.0, what in the world does that look like? Fortunately, there are some great pioneers that I know many of you are familiar with, people from Stanford, people from the Mayo Clinic that have really paved the way for others to follow and learn from. So our Center for Wellbeing actually started over 10 years ago, but 2 years ago, we had a significant pivot, and that pivot included adding several FTEs and changing the structure of our Center for Wellbeing. And we did this with a tremendous amount of generous support from our executive leaders. Not only did we get additional team members to work along the team, we also established an official Chief Wellbeing Officer position that Dr. Burris is in and will speak to a little bit more. So with all of this expansion, we really wanted to be able to develop a model for everyone in our organization to be able to really easily understand what this work was all about, to understand the components of it and how those relate not only to them as an individual, because our ultimate goal here is the flourishing of each individual person within Children's Mercy, and also how we align with the organizational's goals as well. So I'm excited now to move to the how portion of our time together, and you're going to get to hear from these amazing colleagues. We're going to start with Dr. Burris, who's going to give us more of that 30,000-foot view from an organizational viewpoint. Then our nursing director, Kristen, is going to share some more granular information about implementation and programming. And then we will circle back around with Amy Hofflander, who's going to highlight some ways that we are really trying to bake in well-being into our day-to-day work. So thank you for that option to do an introduction. And then I'm going to kick off with some questions to our CWO, Stephanie Burris. So Dr. Burris, tell us who makes up your Center for Wellbeing and why a diverse team really is effective across our organization.
Yeah, Sabra, thank you. As you kind of alluded to before, we are in a fortunate spot here at Children's Mercy in that we have an executive leadership team that really understood that we needed to move the needle on this and that we needed to make a larger impact. So when we were asked to try to address our team members' well-being, our medical director and I knew we needed to get this right. And some organizations would say, oh, you have a CWO and you have a medical director, and that also is a unique situation. But I'll tell you a little bit of how that ended up to be and why it's important. So right away off the bat, we dove into the evidence and then thought about some of our highest need areas. And out of this, we realized we needed to have someone that could oversee and guide this work from a global perspective. And that's kind of where I come in as our inaugural Chief Wellbeing Officer. But we also knew we needed someone to focus on all of our faculty, physicians, trainees, APRNs, our PhD faculty, et cetera. There's some unique needs and opportunities there. Most institutions, because it's such a large bucket, will only focus on that. And that focus is from our wonderful medical director and what she does. Those two alone are, I feel like, really tall tasks in and of themselves. But we also started looking at, again, those higher need areas. And we knew that we needed somebody to focus on our trainees as they have their own unique sets of challenges and barriers. And so we therefore conceived of this idea of having a social worker that was embedded in our graduate medical education department part-time. And then with this, we knew that our trainees would have kind of a trusted person to go to with concerns. And then we thought about all the educational programs or other initiatives that we want to develop or have in place or that were already in place. We've had a Center for Wellbeing, or what was a Center for Professional Wellbeing, for a number of years. And we knew that we needed somebody to oversee those programs and also be trained to continue teaching and leading some of those courses. And this is where our educator, Amy, that's on today, comes into play. With such a diverse background in healthcare and the need to diversify in general, we knew that we needed to make sure that we were creating programs and initiatives that really reached to and spoke to everyone, and that we were intentionally inclusive with those programs. And so here we have created a position for a program director of inclusion who also does some of our educational programs. So really, it has been a nice addition. And partnering with, you said, that takes a village kind of with our DEI folks. And then when going back to where the needs may be the greatest, we of course had to think about our nursing workforce. They are one of the largest disciplines that by and large, many people listening today are probably working with and are so for all organizations. So hiring a director of nursing in the center just made sense to bring that nursing perspective and the knowledge that's needed and really reach that discipline. And that's where Kristen, who's going to talk a little bit later today, comes into place. And then the last big piece was that we knew we wanted to share best practices and some of our initiatives outside of the organization. And we knew we needed someone solely dedicated to thinking about that and thinking about it with a research lens in well-being, and then sharing this broadly. And with that, we've hired a research psychologist to assist with all of that. So when you really think about well-being across the system and then try to conceptualize how and where you can make the biggest impact to try to advocate for those resources that you might need. We all bring different perspectives and knowledge, but together, this team can be very impactful just in different ways.
You're on mute still, Sabra.
My apologies. Please tell us now a little bit about where you see healthcare, well-being in healthcare, Dr. Burris, in 2023 and going forward in the future.
Ooh, Sabra, another great question. I think you touched on a little bit of this and kind of the foundation, but I'll extrapolate on that a little bit more. So to start, many of you listening know that many national organizations have begun to recognize that well-being in our healthcare workforce affects really everything we do, and are really working to shine a light on that, so to speak. This includes some of them that you mentioned. IHI is one of them with their Joy in Work framework, and also the quintuple, what is now the quintuple aim that you mentioned earlier. National Academy of Medicine has also made some recommendations here. The American Medical Association Joy in Medicine Recognition Program is another one. And then, of course, our Surgeon General has really recognized that we are going to be in a crisis unless we affect the well-being of our healthcare workforce. So as such, the well-being of our healthcare workforce is recognized for its effects on quality of care we provide. So if you think about it, if you're burned out or you're stressed, you may not be focused on the task at hand, or you may try to cut corners. And then you put the safety of the patients that we're all caring for at risk. Well-being work most certainly affects patient and family satisfaction. Again, if you're burned out, you become cynical and you can't show up as your best self at times for your patients and families. And then it very clearly affects retention. And we know that working in healthcare is hard and that many people are leaving healthcare in general. So with that said, we all know we need to make well-being a priority to the future. And I think that's what's exciting starting in, many years past, but 2023 and moving forward. So many of the organizations, as you already touched on, Sabra, have gone from this era of distress, the time where people said, hey, you knew what you were getting into, you're going to walk uphill both ways, just figure it out kind of on your own. And some even moved into that, what you talked about, that lovingly we call Wellbeing 1.0, where they started to put well-being committees together, or they started to make some personal resilience resources available, whether it be through a dedicated well-being center or through HR benefits. And while this was a start, and many of these programmatic things are still needed today, in order to really move the needle, we need to move that Wellbeing 2.0 that you talked about. And that's applying those recommendations from the national organizations that I spoke to and really improving the workplace. So we can do all that we need to do for ourselves outside of work. And then if you continue to come to work and are met with barriers and challenging to just getting the work done, you get really frustrated. So really asking, what I hope in the future is really asking in our own organizations, what needs to be changed, and then use improvement science to make those changes. This should be organizational collaborative effort. It shouldn't fall on one group of people. We have a lot of resources here at Children's Mercy, but it doesn't fall on us alone. It really does take a village. And we all need to be prepared to help others in the organization to understand this work and the importance of this work, so we can all move together. Healthcare has changed so dramatically over the course of the years. Of course, the pandemic brought a lot of things to light, but in order to sustain our healthcare work team, we need to take radically different approaches. So moving away from what we knew we were getting into to more of we're here to support you and make the job easier.
Thank you, Stephanie. I know that probably resonates with many people listening in. Can you say just a little bit more about how system improvements can positively impact staff well-being?
Yeah, that's great. That's really moving into that Wellbeing 2.0 that both of us have talked about. And so when you're moving into that Wellbeing 2.0 space, so to speak, you're really changing the culture and you're making those systemic improvements. But you first need to know where the barriers are at or where the challenges lie, right? So you need to assess. And this means assessing your organization either in its entirety or wherever you are focused on, if you have a role in your organization, and finding out what would make the biggest impact. So an easy way to kind of explain this, many of you listening have probably heard it referred to as, is like, what are the pebbles in your shoe? What are the boulders on your back? Those are the easy ways to explain them. I think everybody can kind of understand when you phrase it that way, what you mean. And oftentimes, if you ask it in that way, people will rattle off about 10 things that are challenging to them on any given day. But it's going to be different for different people. It's going to be different for different disciplines, and it's going to be different in different settings, say in the clinic than in an inpatient setting. These can be EMR challenges, they can be portal overburden, or they can even be barriers to teamwork. But it's important to keep in mind that most impactful changes are going to happen at that unit level or the local level. And this takes into account those differences that I mentioned across the board. So when we say well-being improvement work, it doesn't mean that the improvement work has to be one more thing or additive to the work that's already being done. It really means applying a well-being lens to a project or something that's already happening. If you focus on some of those quick wins and you're very transparent about what you're doing and why you're doing it, that meaning it's for their well-being, then you can move on to those larger projects. That really is where you start to positively impact staff, because then they recognize, gosh, I have people that are willing to put the effort in to make this place better for me. And then they have more buy-in, they're more engaged, and they feel listened to and valued. And what a huge impact that can make when people feel listened to and valued.
Absolutely. And we've heard, I heard that echoed in one of the other presentations today, just about the importance of people feeling that they belong, that sense of belonging. And that's certainly a part of our core model here at Children's Mercy. Thank you, Dr. Burris. I think you have teed up very well for us to shoot some questions over to our nursing director, Kristen Ray, who has dove in with both feet and worked on several projects and really has a great relationship with our nursing leaders and also our nurses who are on the front lines. So, Kristen, we'd love to hear about how do you provide emotional support following a traumatic event or crisis? As we know, nurses often find themselves in those roles and providing that care.
Yeah, absolutely. Thank you, Sabra. This is a really important program to touch on because, as Sabra mentioned, nurses and other frontline workers alike, and even in supporting roles, find themselves in need of some of that individual support, or maybe a unit is going through a tough transition and reaches out to the center. And we provide that support in a variety of ways. Individual support, we've really worked as a center to make it easier to access our services. I know that came up as a barrier in many sessions throughout the conference. So we put our submission, our request form right on our intranet homepage so people can easily on their own time go in and put in a request and say, hey, I really need the center to give me a call for this support. And we can answer to that very quickly. So for individual support, one of the members of our Center for Wellbeing team will sit there and actively listen with the employee. We offer in-person, virtual, meeting the employee where they're at to provide that critical support that might be coming after an untimely patient death. It might be something that's going on at home for them, but showing up at work. For a variety of ways, we love to offer that service to make sure we're meeting their needs. And if we from the center cannot do that as an employee, we can refer them, of course, to their EAP offered through our benefits department. We even have an ongoing program that we might be able to refer them to through our internal coaching program, which I know was another great session from this morning, and talking about the value of internal coaching over time and helping people develop both personally and professionally. So it might start as support, it might turn into coaching, but we have many pathways to be able to offer those services. And from a team support modality, we offer what's called ASAP reflections for teams following those critical events. And ASAP stands for aligning support across providers. And again, making sure we are offering that where the team is, when they're available, either in person, remote, hybrid, and allowing those emotional debriefs that often follow a clinical debrief. So when they have their focus on going through what actually happened with the patient during that acute event, but how are we really now processing this? And how can we be self-aware, know what we need to be able to show up then again as our best selves for the next patient, for the next family, for the next shift, and making sure that as a team, they can collectively get together to have that safe space. So really a popular offering among our organization. Most recently, we were even able to pilot group coaching for a couple different groups of nurse leaders. When we talk about that ongoing support and professional development that links so closely with well-being, we talk about being additive with our schedule, and it's like, oh, that's just one more thing, doing group coaching, when we're already so busy. But yet they found it so effective that at the end of the cohort, they decided to continue meeting monthly because they felt the connection was so value added to their jobs and the sustainment of their professional fulfillment. So some really good stuff going on, both from the individual end and the team side.
Thank you, Kristen. We know that you really do have your finger on the pulse of nursing. And with that lens on, tell us a little bit about what the barriers are that you have found and that people have shared with you, barriers in joy, in work and well-being that you're seeing in the nursing cohort.
I don't know how many nurses are on here, but it may be quicker if we list the things that aren't barriers, because right now they're plentiful. I don't even have to say the word staffing out loud because it is just plaguing not only the nursing workforce, but I would venture to say the entire healthcare workforce for all the reasons you already know, but of course the feeling of it. And it used to be where, okay, if we just get over this hump, okay, if we just get over this time period, okay, if we just get to the next fiscal year, if we just get through these traveler contracts, and then yet at the end, it still doesn't feel better. The weight hasn't been lifted from the front line. So of course, an ongoing barrier there. Supply chain issues. I don't know why I thought that was going to be short term, but no. And it impacts so many of us. You think, oh, it might just impact the, certain departments. But the ripple effect of some of those things adds more weight, more administrative burden, more chasing after things you need to take care of your patients, more emails to read. Oh, we just got that SBAR about that change in product. Now we got another one and we got to learn a new ordering number. It could be a variety of things, but all of those things come in and people are looking for flexible schedules. They see their friends, with remote options left and right, but we are still a 24/7 level 1 trauma healthcare center. And we have to keep our doors open 24/7. And we want to, and we are all in it for the same mission, but that comes at a cost. And we're not able to offer some of the same flexibilities that people are offering outside of the healthcare landscape. And so we are constantly fighting against all of these, competing. And, we talk a lot about the gig workforce too, and how we can change to be more flexible, to give people what they need and stay in the nursing workforce. So all of that stuff coming together, and then you've got the burnout contagion. And as soon as a few people feel it, they talk to their friends at the same nurses station. And by the end of the shift, everybody's feeling it, even if they weren't feeling it to begin with. So that then contributes to moral distress, compassion fatigue, all the things, we've talked about at several of these sessions. And it feels heavier now, even though to Sabra's point, it was always there. It's getting heavier.
So what you've just described, I'm envisioning like this huge snowball, just, gaining steam and getting bigger and rolling down the hill. So what can we do about that? How can we begin to tackle that and make some positive inroads?
the million-dollar question. And if I could answer it simply stated, we would all know what to do and take off and hit the ground running. But you all know, attending, there are so many layers to this. And I remember actually walking into Saber's office not too long ago, and I was like, man, I feel like we are doing this, we're doing that, we're doing all this stuff, and I just don't know if people feel it. And she said the best thing she's probably ever said to me is like, Kristen, that's because what we are trying to do is the equivalent of boiling an ocean. And I'm like, wow, that was well said, because that is what it feels like. But it's imperative that we come up with some of these things and we take it one step at a time to make our best a little bit better the next time, and the same time after that, and keep building on some of these things. So when we look at our model, if we focus on that personalized resilience piece, that culture of well-being, belonging standpoint, one thing that we do at the Center for Wellbeing at Children's Mercy is offer a ton of education to our staff members. Specifically for the nursing workforce, I get requests regularly. Hey, can you please come to our next update? Hey, can you come to our next huddle? Hey, can you come to our next well-being or unit council task force? We really want to know more about this. This is what's going on in the unit. Can you bring us some evidence-based strategies that we can try, that can boost our morale, that can help us manage conflict? Because we don't know what we don't know. And we got to all work together to establish best practices and really keep cutting edge staff, bringing that to our front line. We now speak to every single new hire hospital employee on the first day of their orientation. So the Center for Wellbeing at our hospital gets about 30 minutes to outline our program, talk a little bit about our programs and resources, but more important, letting them know we are here for all of them. All 8,400, you need us on day 1, day 2, day 500 of your career at Children's Mercy. We are here to support you. And obviously, to increase access of information, we want people to be able to pull information from the Center for Wellbeing when it's convenient for them, and not to have to constantly, who do I call for this? How do I reach out to them for this? And us trying to push information, because there's too many people in our organization to be effective in that. So one of our projects this past year was to develop a wellbeing toolkit with a variety of resources and offerings for staff in one single place on our intranet. And so it doesn't matter if you work day shift, evening shift, night shift, you can tap into that page. And if you want to listen to a podcast, if you want to read some current research articles, if you only have 3 minutes at huddle and you want to show a quick video on gratitude, we have some videos up there. So lots of different variety of offerings to make sure that they know it's at their fingertips, and they're not hunting down their own resources. We also, sorry.
Okay.
I've got one more thing, but I'm kind of a talker. We also started a program that we're actually doing a research pilot on how can we reach nurses that are experiencing trauma at the front lines of what they do. How do we make them feel seen, heard, and valued in that moment? How can the managers help us to achieve that, knowing, like Dr. Burra said, we can't be everywhere all the time? And so we developed this pilot to focus areas such as the pediatric ICU, the operating room, ED, areas of, again, high trauma, lots of patient death, and making sure we can support staff at those critical times. So all we did was simply put together what we call an SOS bag, which can be commonly referred to as the Save Our Ship bag, but it can also be referred to as what we call supporting our staff. We filled it with 8 to 10 personal care items, maybe a note of affirmation, maybe a fidget, maybe some really nice personal hygiene items, just different types of things, a piece of chocolate candy, anything that makes them feel like, wow, someone saw what I was going through, and I don't feel so alone right now in the moment. So we're working through that research study now and hoping to get some really valuable data about the impact they had. But so far, the qualitative feedback has been really, really inspiring.
Absolutely. It's been great to see that project go into motion for sure. So Kristen, if I am someone working on a unit or in a clinic, what advice would you have for me if I want to try to tackle some well-being projects on my unit? And in particular around that well-being with the well-being improvement lens. We've talked a little bit about that, but what advice might you have? What would that look like?
Gosh, well, anyone that knows me knows I have so much advice. I love that question. I immediately dive in because there is already so much of this work being done that people are labeling as other types of improvement. For instance, when we look at quality improvement that's happening at the front line of the nursing workforce, we have quality improvement committees. A lot of people do quality huddles. They're working on various projects that might stem from their patient and family satisfaction. And what's happening is they might improve a process associated with that. And you know what? After improving that process, the patient and family might not be the only one experiencing benefit from that. What if the change in quality improvement made it better for staff? What if it made it easier for them? What if their patients being happier made their staff happier and influenced their engagement or their overall morale or team dynamic? So that well-being lens can be applied to work that's already being done. It doesn't need to be additive. But there are some key questions that you can ask yourself as you navigate some of those other projects. And that can be simply, does it increase staff engagement? Does it increase your team's job satisfaction? Does it decrease barriers to workplace efficiency? Okay. Does it remove administrative burden? We talk about a ton of burden associated with the time in nursing that we spend in the EHR. I know the same is for many other clinicians in the healthcare setting. Why does it have to take us 25 clicks to document one thing? What if we looked at that process differently and made it more efficient so we could spend more time at the bedside, which is what everybody wants to do? Does it improve overall team dynamic and connection with your staff? Does it decrease the cognitive load? Those are all questions we can move through with that well-being lens and kill two birds with one stone, call it a win-win at the end and say, man, not only are we improving care, but we're improving our team's joy in work, their satisfaction in what they do. Per Dr. Burris, we're removing one of those pebbles to make the walk-in just a little bit easier. It's really great stuff.
Thank you, Kristen, for sharing all of those different aspects of your role and what you're doing and implementing with our nursing workforce. All right, I'd like to now pass the baton to my colleague, Amy Hofflander. And Amy has somewhat of a unique story. So Amy, I'd like to just start out with just tell these folks your story.
Sure. A little bit on my background. My professional history is all in psychosocial care, with an emphasis in child development. So my role was always supporting patients and families during their difficult hospital stays. And I was lucky enough to do that with a very special partner. His name is Hunter, and he is a facility dog that works here at Children's Mercy. So Hunter and I, as a team, would provide that psychosocial support for patients, families, siblings. We would help them feel seen, help them feel supported on those really particularly stressful days. And so I had this kind of dream job situation where I had this ideal role that fulfilled my background, my history, my passion. And I began feeling like I needed some sort of a change. And that's a really difficult place to be in when you have your dream job. Where do you go from there, right? And I learned about an opening for the staff educator position in the Center for Wellbeing. And the more I explored it, the more I realized it was really an opportunity to elevate my current skills and utilizing those psychosocial skills of building connection, connecting with others so that they can feel seen and heard with staff, was really just elevating those skills and roles that I was doing with patients and families. Now I get to do this with staff. Also, Hunter did join me in the Center for Wellbeing, so utilizing Hunter for those same psychosocial supportive roles as well.
Thank you, Amy. Well, tell us a little bit how the Center for Wellbeing, how we mobilize support so our frontline workers have easier access.
Yeah, that's a really great question, and something that us as a center recognized right away. As mentioned before, we can't add things to people's plate when they're already so busy. And in having a culture of well-being is so important. And I think Kristen said it before, but we want to meet the people where they're at. We want to mobilize our efforts so that we can reach as many people as we can where they are and when they are already working, so that they don't have to go outside of what they're already doing to receive some of our services. And a couple of those really special ones that we have 2 carts that we mobilize. One is called our Wellbeing on Wheels cart. We go around to different areas of the hospital. It has self-care items like journals, chapstick, hair ties, some of those things that when you're on shift, it's just amazing to have an extra hair tie sometimes. We also have snacks, healthy items, some comfort food items or candy. Again, it's small things, but you wouldn't believe how much people love Pop-Tarts. It's like this nostalgic thing that just coming where they are and bringing them these items that make them feel similar, as I was saying before, feel seen, feel connected with somebody, feel appreciated. Even though it's a small item, it really helps that staff feel connected. Similar to the Wellbeing on Wheels cart, we have a coffee cart. So a couple times a month, our team goes out with 2 carafes of coffee. We have some cold coffees on ice and some juice, some breakfasty type snacks, and go around bay by bay, bed at a time, go to office suites that may not be in the as recognized areas. They kind of are in those hidden areas and super stressful jobs, but may not be in the vision of everyone that sees staff all of the time, and bringing coffee around. And it brings such joy and such smiles to the staff that receive them. We have a volunteer that brings our Wellbeing on Wheel carts in the evening, so that helps us hit some of those evening shifts, because we know working at a 24/7 institution that we can't just offer it at 9 a.m. on a Tuesday. So we try to mobilize during different shifts. Our staff will come in early to hit some of those night staff or come in on a weekend. Additionally, going to those satellite locations, or if there's a location that we can't physically go to, we will send packages with a lot of these items from our Wellbeing on Wheels cart, so that they still are able to feel seen and appreciated as well. We offer our education virtual whenever possible. This helps those remote workers feel seen and able to access our educational opportunities as well.
Amy, this is kind of a little bit off script, but I would love for you to just share briefly about some other things that have come out of those services. Like when you have, I want you to tell us about your specialized program with Hunter, and I'd love for you just to tell us a little bit about some staff interactions that you've had with people in the midst of when you have been going out. Because what we know is it's about those things, but it's really providing that opportunity or that venue to be able to connect one-on-one with staff.
Yeah, sure. I think one thing that really having Hunter with me can bring that special elevation of connection, like you mentioned, is that these dogs, they're so highly trained, they're so special, but the most kind of magical thing that they can do is that they're so intuitive. They know who needs them. When you're in a room full of people, they know who has that additional layer of stress. And if I let Hunter do his work, he can find those individuals. And unbeknownst to me, most of the time, he can kind of unlock something. And having him there allows the staff to unlock a little bit of maybe whatever it is that barrier of opening up about maybe what's stressful for them, to then open up to me and tell me about what they're going through. I've had a situation where a staff member had come back after a leave, after a family member passed away, and was having a really hard time back. It just happenstance that I came on her first day back after this leave of absence, and she became tearful when she was petting Hunter, and I talked to her about our EAP program and about the Center for Wellbeing and some of those other wellbeing offerings that we had. And I don't believe she would have had that ability to open up and share with me that very personal story about her family member passing away without Hunter's presence. He's the one that kind of unlocked that that ability for her to be vulnerable.
Absolutely. And I know that that person circled back to you after several weeks or a month to say, thank you, Amy. I took those resources that you shared with me, and I went and I got the support that I needed. And I know that's extremely affirming. Amy, I know you were also working towards certification in mindfulness-based stress reduction, which is a huge commitment, and that is mindfulness is a key component of our programming here in the center. So tell us a little bit about what we offer around mindfulness, and maybe how you see that benefiting our employees.
Yeah. So as mentioned before, the Center for Wellbeing has been around for over 10 years, and mindfulness always played a really big role in some of our educational offerings because of the research behind it and the benefit that healthcare workers would receive from mindfulness-based stress reduction courses. So MBSR, or mindfulness-based stress reduction, is kind of the gold standard in mindfulness training. It was created by John Kabat-Zinn in 1979, and he really put the research behind it so that it was able to be adopted in the healthcare systems and really put that validity behind it. And with that research, really was able to bring mindfulness to a lot of healthcare professionals that I think perhaps would have struggled to make that connection from some of those benefits that you could receive from mindfulness. So mindfulness was so important for some of our Center for Wellbeing offerings. So that MBSR 8-week course is one of our major education opportunities. It's a huge commitment though. It's an 8-week course, 2.5-hour classes, there's home practice, and that's a lot to add on somebody's plate. So we also do an introduction to mindfulness course, which is a more succinct 4-week course of 1.5-hour classes. So a little bit more of dipping your toes into mindfulness to see if it fits well into your life. But even further, we have mindfulness moments. So Monday through Friday, every day at noon, we offer virtual mindful moments. So 10 to 15 minutes of exercises, practicing breathing, or settling into the present moment and having that opportunity to really arrive in the place. So often we start our day running and we get the kids ready, and we jump in the car and we get to school, and all of a sudden you realize it's 5 o'clock in the evening and you haven't taken a moment to yourself. And so offering that during the day, during the workday, is such a lovely thing to offer our team. And it's such a short time it's really able to be benefited by many. And then we also do huddle sweeps. Kristen mentioned arriving during meetings that already exist. We have huddle sweeps. They're quick 3 to 5 minute educational tidbits that we can kind of pop in on somebody's already existing meeting and give them some educational opportunities on stress reduction or dealing with automatic thoughts or different helpful skills all rounded around mindfulness.
Thank you, Amy. A lot of good things going on. Well, we are at the 3:04 our time, Central Time, and I want to leave enough time for questions, Julie, if there have been some that have come in for our group.
We do have a couple of questions so far, and thank you for this. This has been wonderful. Our first question is, and probably for Kristen or Amy, do you have a particular model you follow for emotional debriefs?
For the ASAP reflections that I mentioned, where we do an emotional debrief following an event, usually done as a team setting, not so much a model, but definitely a structure to lead into each emotional debrief with the same sort of ground rules. It's the best way I can say. We want to ensure it's safe. We want to ensure it's confidential, that this is a judgment-free space. And so we open up with similar dialogue each time. But the robust part of the emotional debrief from the Center for Wellbeing's role is really to provide listening and letting the team guide the discussion as opposed to directed by our center staff. And if you guys have anything to add, but.
I would just add too that we really try to have that space free from leaders or directors, so that people really do feel comfortable as they can in being able to use that opportunity to really share what's on their heart. We said, we really want you, there's a lot of things that you could share that are going on from the analytical brain side, but this is really about sharing what's really on your heart and in your heart.
Great, thank you. Our next question is, what ideas have you explored or offered around flexibility to counteract the personal experiences with friends and family who are able to work from home? Some things I've heard about are control over schedules, support to really be off when they're away, not having to check email, that sort of thing, shared leadership roles, and alternate career paths.
Sure, I can take that one. The nursing workforce has tried several things in this area, and we've been fortunate where the organization is really supporting units in kind of mini PDSA cycles to try some of these things to see, does it land with staff? Does it work for the people that are coordinating the schedules? So one thing we started doing was offering split shifts. If you are signing up for an extra shift, the former way was it had to be a 12-hour shift if you're working inpatient, but now nurses and care assistants, our unlicensed techs, are allowed to sign up and work partial shifts, which is a really excellent offering for some people that are willing to pick up a little bit and usually pair with someone else, as opposed to having to absorb the whole shift. The other thing is we've got some new scheduling technology coming out in the coming 2024 year, and it's app-based. And it's easier to work through maybe a tiered self-scheduling system. So you might be tier 1 this scheduling round, and you can go pick your shifts first. You might be tier 2, another round might be tier 3. So we're looking at a lot of different ways that we can do our best to enhance flexibility of scheduling, but knowing we'll still need to make sure we have the adequate coverage.
I would say, Kristen, just to expand on that a little bit, Stephanie, you mentioned kind of the quote unquote to be off when they're away. That is part of our culture shift here, right? We have lots of educational opportunities on that and continue to kind of move the needle. So it could be as simple as setting your email messages on delay so they only come during that person's working hours, things like that. That's a huge culture shift. But one that I think the most important thing that we all can do is to model that behavior. I think it's easy to say, hey, I'm just going to check that email really quick and you're on vacation. But what kind of message then are you sending to that teammate, right? You may inadvertently be sending the message that it's okay to do that. So I think modeling some of those things are good too.
This is a good question. We know that night shift nurses are at higher risk for sleep disorders, physical and mental illnesses. Have you targeted any wellness efforts for night shift personnel?
You bet we have. We talk regularly when we roll out new programs and resources. It is very top of mind to say, hey, how do we make sure we can offer these types of programs and resources to all on all shifts? And in one way I can elaborate on that is what Amy mentioned about that Wellbeing on Wheels cart. It's not just a day shift program. We enlisted the help of some hospital volunteers. Sabre worked with some of our connections with spiritual services that were in-house 24/7 and making sure that we're not just going out at 10 a.m. when it's convenient for people that aren't working the front lines, but how do we reach our night and weekend shifts to make sure they feel those same feelings of a culture of belonging and making, sure they feel valued at work and they get the nourishment they need just because it's 2 a.m. versus 2 p.m.
We do have one question about wanting to connect with you after this. I'm assuming that you would be open to anybody reaching out to you after this presentation for additional information. So I encourage anybody to reach out who has a need to get into more detail on some of this. Here's another question though for you. How do you incorporate physician assistants and nurse practitioners into wellness? They're frequently left out of leadership and discussion around wellness.
Yeah, that's a great question. And thank you for that question, Stephanie. And I probably should have given a better answer to that. They are also incorporated into our, we just call everybody faculty to incorporate all of those roles outside physicians. So they're incorporated into physician faculty programming into Wellbeing. Our medical director works with that discipline, those disciplines as well.
And do you use such great questions coming in? Do you utilize social media for communication?
Amy, do you or no, go ahead, Stephanie.
No, go ahead, Saber. It's okay.
I was just going to say, Amy, you have had some work in that in helping to promote some of the programs that you've developed.
Yeah, I would say we haven't used a ton of social media. We do use social media with our dog program. So that has been one piece of our social media platform that we do incorporate with our Center for Wellbeing at times, and other times it's focused on the dog program. We use a lot of our internal emailing system. We call it our daily e-news. So when there's programmatic things that go out to staff, we use a lot of that rather than social media specific platform. But Stephanie, I don't know if you had something else specific that you had in mind.
No, we have used social media when we are AMA accredited Joy in Medicine, recognized, not accredited. We are an AMA Joy in Medicine recognized institution. And so we did a huge social media blast with our comms and marketing team, and are continuing to kind of work with them on what else we can share about best practices on social media. So kind of one of those on the docket things for us here.
I'll just add too, Kim Vipond, who's our social worker that is embedded in our graduate medical education program. She also connects with residents, and a lot of the programs that she's providing for that group of individuals get posted on their internal social network pages. You know, whether it's a bulletin board of the month with a message of compassion and well-being, or other activities that she has put together. And so we're always excited when we see them highlight things that are related to what we're trying to promote for them.
And we do have a comment that frequently this individual hears from providers that email doesn't work as a means of communication. But I think what you're tapping into is looking at the various communication pathways within your organization and being intentional about how you use those pathways. If email doesn't work because of the volume of email and stuff gets missed, then there may be other opportunities to best communicate. But communication is really key to the success of all that you're doing. I don't know if we have one more. We have time for maybe just one more question. If anybody wants to put one in, we've gotten through most of it. I will say that as someone who at my prior organization led the well-being work, I do have a fair bit of resource envy. I'm really impressed with the amount of resources that you have devoted to this. And if you can just very succinctly maybe address how others who are not so rich with resources might approach their leadership about devoting more resources to this.
Yeah, I can take that one, Julie. And you're right. I hear that from a lot. I hear that from a lot of other CWO colleagues, et cetera. We're very fortunate. We know that. I would say develop your elevator pitch. Know your evidence. Look at the national recommendations from a few of the organizations we mentioned today and come up with your pitch of the why. There's lots of data out there on even cost savings of addressing well-being and burnout. Usually executives want to hear, show me the money, or what's the return on investment, right? That's the question you're going to get. So be prepared for those types of questions when you're really advocating for this work.
That's great. Thank you all. This has been a really, really wonderful panel. Lots of rich ideas. So we appreciate your time today. And thank you to our audience for participating and helping us have an engaging conversation about this. So we're going to take a quick 15-minute break, and then please refer to your attendee hub for the link to join our closing keynote conversation for the day, challenges and best practices in addressing and preventing workplace violence in healthcare. It's going to be a really good conversation. So thank you all, and we hope you enjoy the rest of the day.